know that heart disease is the leading cause of death in the United States? There are definitely some factors that increase your risk. So today we are learning more about those factors. Please help me welcome to the show Dr. Michael Gaglia from Cardiovascular Institute of the South. Good morning, doctor.
Morning. Thanks for having me.
Thanks so much for joining us this morning. I'm really interested in this topic. Let's start with this. What causes heart disease?
I think the simple explanation is cholesterol plaque. It's a fatty buildup inside the coronary arteries, which of course supply blood to the heart. And if it either restricts or occludes the coronary artery, then you can either have chest pain or a heart attack from the blocked arteries.
And here's a statistic for everyone. It's very prevalent. It actually says, study shows that it claims more lives than all forms of cancer combined. Is that true?
That's correct.
Wow, unbelievable. So let's talk a little bit about some risk factors now, right? There are some risk factors that you can control and you can't control. Let's talk about the ones you can't control first.
Well, and as we go into this list of factors, I would note that most of these are risk factors that you can control and are not fate. So you can see here that being male is a risk factor. And also family history and your genetic makeup are risk factors. But of course, these are things that are difficult to control, whereas you'll see the list of things you can control is quite extensive.
Very interesting. And as a man myself, I'm very curious. Why are we at higher risk for heart disease than women?
So it would be a long discussion to do that justice, but I think the short answer is genetic makeup in men versus women. And also there may be a protective factor for women that have not yet hit menopause. So women tend to see coronary disease at a later age than men as a result.
Very interesting. Now let's talk about some factors that you can control. Tobacco use, smoking. What are some of the other ones?
So this is what we spend an inordinate amount of time on in clinic because we feel like these are things that we can change, behaviors we can change. So tobacco use is, of course, a huge risk factor for a lot of different things, but for coronary disease, it's at the top of the list. You can control or modify high cholesterol with things like your diet as well as medication. High blood pressure, same thing, diet and medication. Physical inactivity is great for a lot of things, including prevention of heart disease. And as a corollary, losing weight is also something that you can modify as a risk factor. Diabetes is modifiable by diet as well as exercise and medication. And then something that probably doesn't get a lot of attention is stress level, which if managed properly can reduce your risk as well.
Very interesting. I'm curious, doctor, we talked a little bit earlier about the factors you can't control, heredity and family history. Are these the conditions we need to be looking at in our family history to see if we're more, at risk of getting heart disease?
No, that's a fair point. So not only do you want to worry about folks in your family that have a history of heart attack or a history of stroke or any sort of cardiac issues, but you also want to worry about things like diabetes and high blood pressure that also tend to run in families because those things will be more common as well.
Very interesting. Now, the best way to not get heart disease is to prevent it. One thing you suggest is people get preventative checkups. What does that look like? And at what age should men and women be going to get them? 45 and 55, like we saw earlier?
Well, of course, I'm going to be biased because we like to see folks before they have a heart attack. And so the earlier, the better. But most people, after they get past age 40 as a male or past age 50 as a female, it's not an unreasonable thing to see a cardiologist or at least see a primary care doctor that can speak to some of these issues about cardiac risk.
Very interesting. Now, when it comes to talking about, signs and symptoms, are there any we should be looking out for to see if we might be, hopefully not experiencing some heart disease?
So the first thing I would mention is that in some people, heart disease can be asymptomatic until, in essence, it's too late. I wish it were the sort of thing where it'd be an orderly progression from a narrowed artery to a more narrowed artery to a blocked artery. But in some folks who are unlucky enough to have a heart attack, the artery's open one day and blocked the next. So it's not something that we can predict very well at this point. But the typical symptoms that we see on a daily basis are, of course, chest pain or things related to chest pain. So I'm sure you've heard the sensation of the elephant sitting on your chest is the most common symptom that people describe in a textbook. But we see all sorts of folks that have narrowed or blocked arteries and have angina, meaning chest pain from the heart, and have less typical symptoms. Maybe a vague sense of pressure or discomfort, may only be related to shortness of breath, and may be associated with nausea. Some elderly females will present just with dizziness or lightheadedness or feeling poorly. And so not everyone reads the textbook.
And it's important that we pay attention to all this, because if we let this go untreated, do we what then are at more risk for a heart attack?
That's fair. And like all diseases, the earlier you catch things, the better, because we can modify the disease both with dietary and lifestyle changes. We can also put folks on the right medicine that decrease your risk over time. Once we get to the point where the artery is already blocked or severely narrowed, then a lot of our efforts become focused on secondary prevention, meaning preventing the next event instead of the first event. Whereas preventing the first event is always higher yield.
Prevention is key. I think that's so important to know. Doctor, thank you so much for joining us this morning. Get your checkups, everyone. For more information about heart health, you can log on to cardio.com, or you can contact the Cardiovascular Institute of the South by giving them a call at 504-354-5252. Their address is on the screen right there. Stick with us, everyone. We'll be right back.